overseas Filipino worker gets recognition in the global healthcare industry. 32-year-old Dan Lester Dabon is part of the top 100 healthcare leaders list cited by the International Forum on Advancements in Healthcare. Now, Dan is a risk officer under the healthcare government sector in Abu Dhabi, UAE. He also runs his own healthcare consultancy firm. Now, with us all the way from Abu Dhabi is the dapper Dan himself. Good morning, Dan. Thanks for joining us. And first of all, congratulations to you. You're one of the top healthcare professionals in the world.
Good morning, and thank you so much for that, Paolo.
All right.
Good
Dan,
morning.
what does this award mean to you? I can see it right over there beside you. How inspiring is it for you moving forward?
Yeah, for me, this is very personal, and for me, this is an achievement so far because I got to represent my advocacy in a global platform, and knowing that healthcare healthcare management needs to be looked into, especially in the Philippines. And I know that this recognition is just a bonus, but at the end of the day, we still need to continue the legacy and advocacy of, promoting what healthcare should be, the governance, leadership, and direction of healthcare.
All right, let's talk a little bit about that, Dan. The International Forum on Advancements in Healthcare is one of the world's, it's one of the world's top healthcare conferences that explores innovations in the industry. And around 2 years ago, you officially founded the DLD Healthcare Consulting Service. Now, tell us a little bit more about that. What were the circumstances that egged you to finally launch this service? I mean, you've come a long way, starting off as a nurse's assistant, I believe, and look at you now. Owning your own business, named after you, no less.
Yeah, actually, this is very. I started this as in 2015 as just a Facebook group page, and then I was able to help a lot of nurses or other healthcare professionals, say for example, allied health professionals, to land a decent job in the UAE. I help them in terms of their processing of their licensing, and to the point that they got hired, or they get to be hired for a decent job here in the UAE. And then I think that triggered me to put up my own firm, a healthcare consulting firm here in the Philippines. It's a Philippine-based consulting firm because my goal is really to internationalize, or to somehow change the paradigm of the standards of healthcare in the Philippines. And I am very happy that there are many organizations who have been in collaboration with our organization. I know that it's not new, but it's something that we should also embrace, that we need to explore further and challenge the status quo.
All right. Well, it's definitely very timely, Dan. Dan, 10 years ka na dyan sa UAE. And as you mentioned earlier, you're a risk officer. Help us understand what exactly that is, and what it's like to be a risk officer, especially during this time of the pandemic. There are a number of risks, I'm sure.
Yeah, this job is very overwhelming. We focus more on being proactive than being reactive. So based on the identified hazards and risks, and it depends on the magnitude or the severity or likelihood of what has to come, or what has to happen, or what would be the consequence of such incident. We develop projects, initiatives, and programs to ensure that these risks are properly mitigated. And aside from that, if these are reactive cases, we look at into the trends, and we analyze the data for us to be able to, again, to provide a high-level action plan for us to reduce the residual risk rating.
All right. You're definitely on the ground, on the front lines of this battle, Dan, and you've seen world-class healthcare, the sector really sort of develop and grow. Here in the Philippines, what are your plans and hopes for that particular sector, and what have you learned that we can sort of transfer here in the Philippines?
Well, I will continue what I've started. I will continue this advocacy, basically to ensure that everything is taken into consideration, and ensure that we take things proactively. At the moment, we always say, or we always react based on the incidents or based on the trends, but we don't react on the proactive case, such as we identify first that it's going to happen. That should be the concept of healthcare for us to be able to provide a world-class patient experience and at the same time provide a quality service in terms of rendering our patient care.
All right. Well, Dan,
And
this award.
this pandemic has really taught me a lot because we were able to establish a good program, especially here in the UAE. As a matter of fact, we just recently won in the International Best Practice Competition in New Zealand. We were able to establish projects such as drive-through screening centers, prime assessment centers, and vaccination. So this is just a very overwhelming experience, and I'm very grateful that I had the opportunity to have these experiences.
All right, the awards continue. These are no, this award is no small thing. We want to say congratulations to you again, Dan, and thank you for taking some time off. I'm sure it's a lot earlier over there than it is over here. Thank you for joining us this morning right here on New Day.